today I want to talk about the scars after rhinoplasty. So a lot of patients ask us, doctor, where is the scar for the rhinoplasty? If the scars were visible, I mean, we have done it on actors, actresses whose faces are extremely close up in the camera. And if these actors, actresses, or anyone are able to get away without scars, which means it is being done in a way which is correct. If scars in a rhinoplasty are seen, then no one would get them done. So let me explain to you about the scar which is there on the nose. The most important scar in an open rhinoplasty is there is a little scar here. This little scar is the only thing that is through which we can access. Also, if we are reducing this part of the nose, there is a little scar along this line, which is already a groove, so it's never seen. So a lot of Hello everyone, my name is Dr. Karan Shetty. I'm a plastic surgeon here at Tara Healthcare. We are from Bangalore. Today we're going to be answering some questions sent to us by our listeners from Instagram and YouTube. These are some important questions which we have filtered down from, I think, about 50 to 60 questions that we got, and we have filtered them out to about 10 to 15. So let's get into it. So our first question is, can rhinoplasty change your face? A rhinoplasty should not be changing how your face looks. It should improve your nose. It should improve the harmony of your face. It will never be you should never get a rhinoplasty done where you're in a position that after the rhinoplasty your face looks different. It should look harmonious. It should look better than what you did. And either ways, I think the question is also intended to, in terms of, say, people recognizing you, there won't be any difference. They'll just see that there has been some improvement in your face. Will it affect your, say, your passport or your Aadhaar card? No, it doesn't, because the change in the nose is not so huge compared to, say, a change that requires you to go change your passport or your Aadhaar card. So I hope this has helped you understand. Rhinoplasty is always done to improve your nose and to improve the harmony of your face, but it is never done to change your face. So all these myths about, undergoing plastic surgery and changing the person's face never happens unless you undergo a face transplant. A lot of people ask me, what is the biggest challenge while doing a rhinoplasty or in a rhinoplasty? The biggest challenge in a rhinoplasty is to get patients' expectations right. This is the biggest challenge I feel in rhinoplasty, because after doing so many rhinoplasties over these years, I have realized if you, the patient, and I am in sync in terms of what I can deliver and what you expect, I think that once that challenge is crossed, then everyone is happy. Thank you. How do I prepare for a rhinoplasty? Firstly, you have to have an idea of what you want with your nose, the changes that you want with your nose. You have to come see us. We have to consult. We have to be on the same page. We have to have a plan of action. We can do a 3D consultation with Chrysalix to kind of understand how your nose, to a certain extent, will look post-procedure. Then we have to do a set of blood tests to see how fit you are for the procedure. Then we do the procedure itself. We have to speak about the post-operative road to recovery. Post-surgery is as important as the surgery itself. So, and yes, preparation for any surgery is very important. Usually after 1 week to 10 days after the rhinoplasty, we show you how to tape the nose so that you can do it yourself. Taping the nose and removing the tape of the nose is very important because you don't want to be removing the tape of the nose, and the tape should not pull the skin away from the structure which is there inside, which can again cause swelling and this. So today I'm going to show you how to tape the nose and how to remove the tape. So taping of the nose can be done with, we use two types of tapes. One is these Steri-strips, which are white in color, and one of these skin colored Steri-strips. Just for the ease of showing it to you today, I'm going to be using the Steri-strips. We use either one of them depending on what our patient requires. So once I open the Steri-strip, I'll be cutting them into small pieces. So basically you have to divide the nose into the upper bridge, the middle part, and the tip of the nose. So once you see the nose, you can kind of decide that the bridge of the nose needs to be smaller, the middle of the nose, the length of the Steri-strips needs to be longer, and then we have a U-shaped tape that we use for the tip. So as you can see here, I cut them into almost like a 2/3, 1/3 kind of situation, and then I start taping the nose. This is something that you can do on your own. So you start with the bridge of the nose and press it. So you press it firmly so that the skin kind of settles into the, so you do about like a 60%, 40%, and then this, and then we use the longer part. The longer part is for the bridge of the nose, or as you can see here, I'm going right at the supra tip of the nose, which is just above the tip of the nose, that compresses that area. You can put one more to kind of seal that in place. And then we have a U suture. This is basically, doesn't cover the nostrils, but it kind of compresses and kind of pinch it over there. So this is a general idea on how to tape the nose. Remember, when you are taking it out, to make it wet, either with a glue remover or with water. When you're having a shower, you can kind of make it wet, and then slowly you take it off, giving counter pressure to the opposite side. So make sure when you are taking the plaster out, as I'm showing in this video, you don't remove it in such a way that the skin peels off along with the, so the entire exercise is a waste. So this is what you shouldn't do. And then, like, see here, I'm just peeling it off the skin. So that skin which is being peeled off comes off the inside structure as well. So you don't want that. So you make it wet, you make it easy for it to peel off, and then you pull it in such a way that the skin which is attached down does not come off from the underlying area. So this is how you tape the nose. I hope this has helped you.